So welcome everyone, and thank you for joining today for this short presentation as part of our activities for World Antimicrobial Resistance Awareness Week. Hopefully by this stage you will have the opportunity to review some of the materials provided this week to raise your awareness and gain an understanding of the issues surrounding antimicrobial use and the development of resistance. We have some very informative blogs and articles published this week. All of these are prepared in-house, and these expand on some of the topics we will cover here today. So this presentation is designed to give you an overview, some important facts and figures, and hopefully highlight the importance of World Antimicrobial Resistance Awareness Week. So what we will cover in this session, so hopefully by the end of this presentation, we will have answered some of the following questions. Why are antimicrobials so important? Why is antimicrobial resistance a universal healthcare problem? What is the link between antimicrobial use and development of resistance? How can antimicrobial resistance be addressed? What is the importance of World Antimicrobial Resistance Awareness Week? So this is a very, very topical area, and it's often highlighted in the media, in academic research, and even simply when we visit our GP surgery and hospital through flyers, posters, etc. However, it is particularly important in the pharmaceutical industry and something we as consultants all should have awareness of. So they might not always directly impact our day-to-day regulatory activities. Background and knowledge of the topic is important to have in your arsenal. So the term antimicrobial refers to a substance that inhibits or destroys bacteria, parasites, viruses or fungi, but the term also refers to medicines used to treat or prevent infections caused by said organisms. Antimicrobials fall into four categories. Your antibacterials and antibiotics belong in this category, antivirals, antifungals and antiparasitics. So just to quickly clarify some of the terms frequently used in this area. So an antibiotic is a compound that inhibits the growth or kills bacteria. In recent years, antibiotic has become synonymous with antibacterial. And antibiotics are a type of antimicrobial and used when bacterial microbes are harmful to human health to treat bacterial infections by targeting bacteria causing disease. An antibacterial is a drug, chemical, or other substance that kills bacteria, and this is termed as bactericidal, or stops their growth, which is termed as bacteriostatic. An antimicrobial is a drug, chemical, or other substance that kills, inactivates, or slows the growth of microbes, including bacteria, viruses, fungi, and parasites. And then you have your antifungals, used to treat or prevent fungal infections, and your antiparasitics, used to treat or prevent parasitic infections. So antimicrobial resistance is one of the most significant challenges for the provision of safe, high-quality health services across the world. The term antimicrobial resistance refers to the failure of an antimicrobial, which includes antibiotics, to inhibit or destroy bacteria, parasites, viruses or fungi, for which it has been designed using standard dosing regimes. So antimicrobial resistance also increases the complexity of treatment and places a significant burden on patients, health service organisations and the health system. Antimicrobial resistance has a direct effect on patient care and creates a set of critical ongoing challenges to health service delivery. Not only can it increase a patient's length of hospital stay, but it increases the severity of patient illness. Severe infections caused by bacteria that do not respond to available so-termed last-line antimicrobials, and these include antibiotics, can result in serious complications and cause serious disease such as septicemia. So the Deputy Secretary General of the UN was quoted recently as saying, antimicrobial resistance is one of the most pressing issues globally, not only for human health, but it is a multi-sectoral problem involving animal health, agriculture, the environment, trade, and many other sectors. And this is the One Health approach, in which we have a very informative article published as part of this week's activities, so I will not go into too much depth in this area here. Echoing this statement, the Director General of the World Health Organization has quoted saying a lack of effective antibiotics is as serious a security threat as sudden and deadly disease outbreak. Strong, sustained action across all sectors is vital if we are to turn back the tide of antimicrobial resistance and keep the world safe. And I think to me particularly this statement rings very true in light of the recent pandemic. So it is reported that organisms, particularly bacteria, resistant to current antibiotics cause more than 750,000 deaths worldwide every year. And this includes 230,000 deaths from multi-resistant disease. This is resistance to more than one antimicrobial. Referring to the model, it is a somewhat frightening figure. It will have overtaken the number of deaths caused by cancer in the next 25 years if current trends continue. Without any action to stop the spread of resistance, it is predicted that this number will rise to 10 million deaths per year by 2050. The economic burden from increasing resistance is estimated to cost about $100 trillion globally by 2050. We'll talk a little bit more about these figures in the next slide. So let's take a closer look specifically at antibiotics. Consumers are aware that antibiotics treat infections. However, consumers may not be aware that antibiotics are essential in preventing infection after surgical procedures and for patients receiving treatment for other conditions, such as for those receiving chemotherapy. Antimicrobial resistance has a significant and direct implications on patient care. Antibiotics play an essential role in preventing infection after surgery. For example, people currently undergoing surgical procedures such as hip and knee replacements would receive standard prophylactic antibiotics and currently experience infection rates of about 0.5 to 2%. However, if access to effective antimicrobials were reduced through antimicrobial resistance, post-operative infection rates could rise to around 40 to 50%, and up to 30% of these patients could die from these infections. Antimicrobial resistance also impacts on a range of treatment options, such as chemotherapy for cancer patients, which may no longer be a viable or safe option due to the increased risk of complications and infections resulting post-treatment. This reduction in safe and viable treatments and services available to be offered by the health facilities would have a negative impact on the effectiveness of the healthcare system in the long term. In 2014, the UK government commissioned a review on antimicrobial resistance, which investigated the global economic cost of the infections caused by resistant bacteria. The work in Europe indicated that if current trend increasing antimicrobial resistance continues, like we've said in the current slide, by 2050, not only will approximately 10 million people die every year as a direct result of resistant bacterial infections for which there is no effective treatment, but gross domestic product would also decrease as a result of this resistance, with the review indicating this would translate to a reduction in global economic output worth between $60 to $100 trillion. So now some information you may not be fully aware of regarding how antibiotics work. And don't worry, I won't get too technical, but do reach out to further information, or if you'd like more information or a deep dive into antimicrobial or indeed any antibiotic mode of action. So antibiotics have a spectrum of activity. Some antibiotics can treat one or a few species of bacteria and not others. For example, they might treat gram-positive organisms. In general, gram-negative bacteria are more virulent and cause more serious disease, more so than gram-negative. And some of these may not treat gram-negative organisms or vice versa. And these are known as narrow-spectrum antibiotics. Antibiotics that kill or inhibit many species of bacteria or cover multiple classes of gram-positive and gram-negative bacteria or cover multiple aerobic, anaerobic, and atypical bacteria are known as broad-spectrum antibiotics. Because you only want to target the bacteria causing the infection and not kill the good or commensal bacteria or cause other bacteria not causing the infection to acquire resistance genes, it is important to use narrow-spectrum antibiotics wherever possible. In general, the impact of medications are limited to the patient taking them, but the use of antibiotics has an impact not just for the patient, but the community as well, the so-called tragedy of commons. And here you have a little diagram here to aid in this understanding. So the individual benefit to the individual is immediate effectiveness of antibiotics against disease. The common extremities, such as other patients that can have an increased risk of antimicrobial resistance infections, and within society, the impact is reduced antibiotic effectiveness, and higher healthcare costs. So, how does antimicrobial resistance develop? Antimicrobial resistance occurs when organisms develop resistance to an antimicrobial that was previously an effective treatment. So, for example, bacteria can develop natural defenses against antibiotics. When this occurs, potentially due to prolonged exposure or overuse of a particular antimicrobial, the antimicrobial's effectiveness to treat the infection decreases, and it may reach a point where the antimicrobial has no benefit. The overuse of antimicrobials in health, both human and animal, and agriculture has increased the amount of exposure organisms have to them, giving said organisms more opportunity to develop resistance. The process of natural selection, which is your survival of the fittest, favouring strongest organisms that develop the strongest natural defences, fuels the increasing prevalence of antimicrobial resistance. So new challenges in infection control resulting from more complex healthcare, for example, outpatient chemotherapy, and increasing domestic and international travel have increased the spread of resistance among organisms both between individuals and between countries. When patients do have longer hospital stays, this may increase the chances of patients acquiring resistant organisms from other patients. So, as we said earlier, addressing the rising threat of antimicrobial resistance requires a holistic and multi-sectoral approach referred to as the One Health. Because antimicrobials used to treat various infections in animals may be the same or similar to those used for humans. Resistant bacteria arising in humans, animals, or the environment may spread from one to the other, and even from one country to another. Antimicrobial resistance does not recognise geographical or human-animal borders. A very important topic to note. So some UK-specific figures now show that where we use antimicrobials, and so these are used in the human population, in the community, i.e. your GP prescriptions, in hospitals for treatment and prophylaxis. In the animal population, to treat our pets and our livestock, again for treatment and prophylaxis. And in agriculture, so this would be in crops and agriculture, primarily antiparasitics and antifungals would be used in this group. So some of the figures there show the use of where our antimicrobials are used. This is very relevant to the UK. So resistance is not new. An interview shortly after winning the Nobel Prize back in 1945 for discovering penicillin, Alexander Fleming said, "The thoughtless person playing with penicillin treatment is morally responsible for the death of the man who succumbed to infection with the penicillin-resistant organism." So this brings the message true, especially to me, working in the field of antimicrobial resistance, that even back at the very beginning and the dawn of our antimicrobial use, the problem of resistance was flagged. So I'm going to give you some very brief snapshots and some figures to highlight not only the extent of resistance, but how quickly resistance patterns are changing. So here we have a graph dating between 2013 and 2018. And this shows for one bacteria, Enterobacteriaceae, and its resistant patterns becoming more prevalent in Europe over a very short period of 5 years. So as you can see by the color coding, resistance patterns for this particular microbe are increasing. And this is in a very, very short time period. You can see the stark difference in the colors there. And this really highlights to me, I know this is only one bacteria, but this trend is noted among multiple different bacterial products. So as we have examined, antimicrobial use is a key factor in the development of antimicrobial resistance. The more antimicrobials are used, the more likely it is that resistance will develop. So this slide shows the occurrence of penicillin non-susceptible Streptococcus pneumonia, a bacteria that causes middle ear infections, sinusitis, acute and chronic obstructive pulmonary disease, pneumonia, meningitis, and septicemia in worst case scenarios. And this is plotted against outpatient use of penicillins in 20 industrialized countries. So there's a representation which clearly demonstrates the relationship of antibiotic usage with the development of penicillin resistance. The key takeaway message here is that as use has increased, so has resistance. And again, this is only showing for one bacteria. This is a trend that has been noted over multiple bacterial classes. So why can't new antimicrobials be developed to tackle resistance? Well, they can be, but there are a lot of reasons why this is a very slow and complex process. So many pharmaceutical companies have stopped developing antimicrobials over the last 20 years, resulting in very few new antimicrobials being developed and released onto the market. The reason for this decline is that antimicrobials, and antibiotics in particular, are extremely expensive and resource intensive to develop. The World Health Organization reviewed the publicly available information on the current clinical development pipeline of antimicrobial agents. The review showed the current clinical pipeline is still insufficient to mitigate the threat of antimicrobial resistance, particularly to those useful against gram-negative bacteria, and that would include bacteria that cause TB. Most agents in the pipeline are modifications of existing antimicrobial classes. Therefore, they're only short-term solutions, and they usually cannot overcome multiple existing resistance mechanisms. So the pharmaceutical companies that have released new antimicrobials recently have had very poor return on investment from them. There is much more incentive to develop the next cholesterol-lowering medication that a patient will take once a day for the rest of their lives, rather than an antibiotic that the patient will only use for a short period of time and the bacteria will inevitably develop resistance to. This is reflected in the figure on this slide, and this is comparing the sales of recently launched antibiotics to medications for metabolic disorders such as Genava, which is used for type 2 diabetes. So antimicrobial resistance threatens the foundations of modern medicine. Coordinated and immediate action on a global scale is required to respond to the increasing occurrence of infections resistant to last-line antimicrobials in particular. In May 2015, the World Health Assembly adopted a global action plan on antimicrobial resistance, which outlined 5 key objectives. Firstly, to improve awareness and understanding of antimicrobial resistance through effective communication, education and training, and this is a big part of why we are celebrating this week. Strengthen the knowledge and evidence base through surveillance and research. To reduce the incidence of infection through effective sanitation, hygiene and infection prevention measures. To optimize the use of antimicrobial medicines in human and animal health. And to develop the economic case for sustainable investment that takes account for the needs of all countries to increase investment in new medications, diagnostic tools, vaccines and other interventions. So it is believed that with a coordinated global approach, the goals of reducing and preventing infections resistant to the last line of available antimicrobials, including antibiotics, and the ongoing delivery of safe healthcare with high quality assured and effective medications is achievable. So there are different measures to how we use antimicrobials. Utilisation shows the volume of antimicrobials we are using, but it doesn't show how well they are being used. For example, a hospital specialising in oncology would use more antibiotic per population than a hospital specialising in rehabilitation, for example. Using raw consumption figures may suggest that high use and broader spectrum used in the oncology unit is wrong. But on the other hand, knowing that 90% of patients got an antibiotic may help explain selective pressure and the resistance occurring in that unit. Appropriateness measures how well antimicrobials are being prescribed, where they are a good or a bad choice, what percentage were prescribed inappropriately, and do they follow guidelines and indicated for that infection being treated. So why is inappropriate use so important? The term inappropriate use means treatment which is not in line with the recommendations or local guidelines. Very few patients receive ineffective treatment, but therapy which is too broad spectrum is associated with increased risk of resistance or other side effects. Increased risk of adverse effects may include antimicrobial resistance in your current and future patients, antimicrobial allergy, treatment failure, toxicity, infections such as C. difficile or MRSA, increased healthcare costs, for example, your length of stay in hospital. Some reasons that a prescription or antimicrobial use can be classed as inappropriate can be incorrect route, dose or frequency in prescribing, the medications being taken for the incorrect duration, or the spectrum may be too broad or too narrow. So while it's important for those prescribing antimicrobials to be very aware of local guidelines, the onus also falls on the user of antimicrobials to use them under the way that they've been guided to and follow the instructions closely. So what is needed from a healthcare perspective to tackle resistance? Well, it's very simple things that can be implemented to address this. Early prevention of infections, so that the infections don't go so far where high doses of antimicrobials over a long period of time are needed. And this involves timely and accurate diagnosis, appropriate prescribing and use of antimicrobials only when there is infection for which they are most appropriate treatment. So as I've said before, antibiotics cannot be used to treat bacterial infections. Very often GPs have reported they feel very much under pressure by patients to prescribe antibiotics for other infections that are not bacterial. And that's maybe due to lack of understanding and knowledge on the topic, but it does have a high impact on antimicrobial resistance trends. Effective management of infections, so if infections can be managed, prevent spread, prevent duration of disease, that will then lessen the need for antimicrobial treatment. And development of alternatives to current antimicrobials. So the UK government has developed an antimicrobial resistance 5-year National Action Plan, or NAP, to control and contain antimicrobial resistance by 2040. So we saw some of the figures we looked at earlier that were projecting figures for 2050. So we really need to get a hold on preventing the extent of those figures, and they've given that deadline by 2040. The action plan covers actions across the human and veterinary medicine, food production, but also agriculture and also in research. So the overall aims are to optimise the use of antimicrobials and reduce the need for an unintended exposure to antibiotics, and support the development of new antimicrobial drugs in the pharmaceutical industry. So the National Action Plan contains a number of ambitions, and this includes having the number of healthcare associated gram-negative bloodstream infections, reducing the UK antimicrobial use in humans by 15%, and this includes a 25% reduction in antimicrobial use in the community, and a 10% reduction in the use of reserve and watch antimicrobials in hospitals. And these are ones that are really put on hold as your last line antibiotics. And also by reducing the incidence of specified drug-resistant infections in humans by 10%. So let's hope the implementation of the NAP is overseen by the UK AMR board, and this is jointly overseen by the Department of Health and Social Care and the Development for Environment, Food and Rural Affairs, again highlighting that the need for a One Health approach to tackle antimicrobial resistance. So let's take a very quick look at antimicrobial resistance during COVID-19. So as I said, antibiotics don't treat or prevent viruses, including the one that causes COVID-19. Correct diagnosis is vital for treatment. Testing helps distinguish viral from bacterial infections, and this makes it far less likely that antibiotics will unnecessarily be prescribed and used, in turn lowering the risk of antimicrobial resistance and optimizing patient care. An interesting takeaway from the graph shown on your screen is the fall in the volume of antimicrobial supply between April and December 2020 compared to the same period in 2019. There was a significant drop of 39%. Now, a lot of this may be due to the fact that we were isolating. There was a fall in the spread of other infectious disease that may have required antimicrobial treatment, but it also perhaps highlights the overuse and misuse of antimicrobials. That is, they're being prescribed where they're not actually needed. So it is very important to note that some patients with COVID-19 may develop bacterial co-infections, and in this case, the health workers might prescribe antibiotics to help treat secondary bacterial infections in those patients, but primarily antibiotics should not be used to treat COVID-19. So a lot of material has been provided this week, and hopefully for now you have an understanding of the importance of what is World Antimicrobial Resistance Awareness Week. So it really is to raise our consciousness, and it runs every year from November 18th to the 24th. And it is all about our antimicrobial resistance and how the medical community is educating us about the proper use of these disease-fighting drugs. So just to bring you a bit of a background about the history of it and the final takeaway. So the World Health Organization projects a sense of urgency around the global issue of resistance. And they saw this as an increasing problem all over the world, especially as poverty-driven conditions cause illnesses and infections that were increasingly resistant to antimicrobials. So in May 2015, the World Health Assembly upgraded this resistance to an international emergency. The World Health Organization described the problem as new resistance mechanisms are emerging and spreading globally, threatening our ability to treat common infectious diseases. A growing list of infections such as pneumonia, tuberculosis, blood poisoning, and foodborne diseases are becoming harder and sometimes absolutely impossible to treat as antimicrobials become less effective. As we discussed, the World Health Organization outlined 5 goals about global antimicrobial resistance, including raising awareness, which is what we're doing here this week, increasing monitoring and research, reducing infections, making the best use of antimicrobial medications, and continuing to have a sustainable investment in research. But most importantly, these goals formed an antimicrobial resistance framework that nations could use to prioritise medical experts and researchers in their countries to allocate these resources. In addition to preventing disease in humans, national action plans were to align with global efforts in creating antimicrobial medications for better animal health as well as in agriculture. So since then, there has been increasing news coverage, both locally and internationally, on the widening problem of resistance. But to learn more about what's happening in the world and what you can do as an individual and in your community, you can log on to the World Health Organization website, and we have lots of links provided this week, and have a look at some of the great ideas and things that you can do. And hopefully the materials that we have circulated this week have been of benefit to you and you have taken away a strong message. And these messages, key messages to take away, are antimicrobial resistance occurs when an organism evolves and develops resistance to an antimicrobial that should inhibit or destroy it. Antimicrobial resistance is reducing the effectiveness of antimicrobials to treat infections, and antimicrobial resistance is happening now, and it is something that is ongoing and that does need to be addressed. As we have discussed, very few new antimicrobials are being developed. The misuse, overuse, and inappropriate use of antimicrobials all contribute to antimicrobial resistance. And antimicrobial stewardship works hand in hand with prevention and control strategies to help address antimicrobial resistance. An important message is it's not just the regulators, the health authorities, the prescribers, the onus falls on the users of antimicrobials as well to be vigilant. So thank you all so much for your time to listen to this presentation. If you have any questions at all, please do feel free to reach out to myself or any of the blog authors that have helped prepare materials for this week. As I said, there's a lot of information has been circulated and a lot of links to information. If you have any questions or you'd like a deeper dive into any of the topics that we discussed, please do feel free to reach out. And if you wish, please do Give some feedback to this presentation and add it to your own personal training record. Thank you.